Dr. Merrill here with Coates Hearing Clinic. Today we're going to give you a tour of our balance suite. As many of you know, the hearing and the balance system are both connected to each other inside a patient's ear. Many patients who suffer from hearing loss also may suffer from balance disorders, including overall instability and unsteadiness, spinning, or overall dizziness. We are so happy that we are now able to provide services to be able to test for these balance disorders. 3 of the main tests that we do are called a VNG, an ECOG, or a VEMP. All 3 of these tests we are able to do in our clinic to determine what might be going on with the balance system inside an ear. When a patient comes to our clinic, they will enter our balance suite right here. Now we are going to come in, we're going to see a big black chair. This chair is able to recline to give the patient the most comfortable situation to sit in, as well as complete some testing that might be needed to check the balance system. Over to the right is what we call a light bar. This light bar is used during a VNG to track eye movements. There is a red dot that moves in different patterns that the patient will track with their eyes. This will check to see how well the visual system is responding to the balance system in the ear. We then go over here to the workstation. This is where Dr. Merrill or Dr. Coates will be using the computer to test and analyze data for the patient. We come over here. This equipment right here is used specifically for the VNG. The goggles are used and placed on the patient's eyes, and they will track the eye movements for the remainder of the VNG test. This cover can now also close onto the patient's eyes to have vision denied. This machine right here is what we call a caloric machine. This will add warm and cool air to the patient's ears to stimulate the balance system to be able to determine if one ear is weaker than the other in the balance system. We then come over to this side. All of this equipment right here is used for what we call a VEMP or ECOG. What these 2 tests do is to determine different disorders of the balance system or the vestibular system. A VEMP will determine if a patient has a very specific balance disorder called semicircular canal dehiscence. And an ECOG will help test Meniere's disease, or when a patient has fluctuating hearing loss, ringing in the ears, oral fullness, and spinning or dizziness. We come back over here. Here is the workstation, as we said, Dr. Merrill and Dr. Coates will be working in. And if you see from over here, this is the view from the back, and we have the chair and the light bar all set up for the patient. We look forward to helping all of the patients that have dizziness and off-balance issues, and we are so excited to help provide care to our community.